Depression is more than just feeling sad or going through a rough patch. It's a serious mental health condition that affects millions of people worldwide, cutting across age, gender, and background. While everyone experiences moments of sadness or disappointment, depression is different. It is persistent, often lasting for weeks, months, or even years, and it can deeply impact every aspect of a person's life. At its core, depression is a disorder of mood. It can make even the simplest tasks, getting out of bed, eating a meal, or talking to a friend, feel overwhelming or impossible. People with depression may lose interest in activities they once enjoyed, feel hopeless about the future, or struggle with low self-worth. These feelings aren't just fleeting emotions, they are symptoms of an illness that changes the way the brain works. The causes of depression are complex and varied. Genetics play a role, meaning that if someone in your family has experienced depression, you might be more likely to develop it as well. But genetics are only part of the story. Life events such as trauma, loss, or chronic stress can trigger depressive episodes. Changes in brain chemistry, hormone levels, and even certain medical conditions can also contribute. Depression doesn't always look the same for everyone. Some people may appear withdrawn or tearful, while others might seem irritable or angry. For some, depression manifests as physical symptoms, like headaches, stomach problems, or chronic pain, without an obvious emotional cause. This can make it difficult to recognize, both for the person experiencing it and for those around them. One of the most challenging aspects of depression is the stigma that surrounds it. Many people mistakenly believe that depression is a sign of weakness or something that can be overcome with willpower alone. But depression is not a character flaw or a choice. It's a medical condition that requires understanding and support. Fortunately, depression is treatable. A combination of approaches often works best. Psychotherapy or talk therapy can help people understand and manage their thoughts and feelings. Cognitive behavioral therapy, for example, teaches skills to challenge negative thinking patterns and develop healthier behaviors. Medication can also be effective, helping to balance the brain chemicals involved in mood regulation. For some, lifestyle changes, like regular exercise, healthy eating, and maintaining social connections, can make a significant difference. It's important to remember that recovery from depression takes time, and what works for one person might not work for another. If you or someone you know is struggling, reaching out for help is a crucial first step. Talking to a trusted friend, family member, or healthcare professional can open the door to support and treatment. Depression can feel isolating, but no one has to face it alone. By learning more about this condition, we can break down the barriers of misunderstanding and stigma. We can create a world where people feel safe to seek help and where hope is always within reach. If you notice someone withdrawing from activities, expressing hopelessness, or talking about feeling like a burden, reach out. Sometimes, a simple conversation can make a world of difference. And if you're experiencing these feelings yourself, know that help is available and things can get better. Understanding depression is the first step toward compassion and healing. By recognizing the signs, supporting those who are struggling, and encouraging conversations about mental health, we can all play a part in making a difference. Remember, depression is common, treatable, and nothing to be ashamed of. With the right help and support, recovery is possible, and a brighter future awaits.